Yeah. Well, let me give you a sense of my organization first. Okay, so I started as an infection coordinator and became an infection prevention manager for a hospital that's part of a system here, of a 21 hospital system. So we have 21 hospitals, thousands of clinics. And then we're also part of a bigger enterprise. So there are other regions, but there's one region here, Northern California, with 21 hospitals. Um, so after 4 years of being a manager, I, I I just grew tired of it, really, of the politics in a hospital. It can get redundant and cyclical, and I just wanted to expand my influence. And this is the public health in me. I think as I've told you, we're like a small country. There is an opportunity for me to influence change at a different level, and be able to move forward infection prevention interest at that level. So I moved to the regional office, um, and became actually not an infection prevention coordinator, but a consultant that has infection prevention expertise. Um, and then I did that. I don't know why this keeps happening to me. I think I did that for 2 years. And then there was a reorganization, and my manager at that time got reorganized out, and I ended up being by myself. And at that time, and there was also reorganization happening at the local level, and essentially all our IPs had been moved around so that we only have one IP per hospital. So you can imagine uh, how traumatic that was for everybody. But anyway, and really the first project that was given was how to centralize our surveillance for 21 hospitals. And that gave me the team that I started with. I started centralized surveillance with 4 team members. Um, and by the way, this was the time of Ebola. So it was too much. But anyway, so I moved up to region, as I said, with centralized surveillance. I had 4 teams, and I really worked hard to create a program regionally, and was fortunate enough to have very creative, forward-looking leaders at that time, and I was able to uh, successfully convince everybody that we needed a program from a regional level. So from there, I've grown my team. I now have 11 people reporting to me, one of which is actually not infection prevention because my portfolio expanded a little bit. But I have 10 infection preventionists working with me at the region, and then I have interns, and also a project manager who is a contractor. So it's quite a big team for me, but we're a big system, and their work is to support medical centers.